Heart disease is the #1 killer in the world that kills about 33% of people. However, up to 80% of heart disease is preventable. But there's one biomarker that's one of the biggest predictors of heart disease, and it's genetically determined. You could be walking around every day with dangerously high levels of this biomarker and increase your risk of heart disease in 10 to 50 years. It's called Lp(a) or lipoprotein (a). Lp(a) is a low-density lipoprotein that contains another atherogenic apolipoprotein called ApoB, as well as ApoA. Lp(a) is the strongest genetically determined atherogenic lipoprotein, with 90% of Lp(a) levels being explained by a single gene called LPA. Lp(a) levels can vary 1,000-fold between people, ranging from close to 0 to 300 mg per deciliter. Lp(a) below 50 mg per deciliter is considered to be normal, but anything above 8 is already linked to a higher risk of heart disease. A 2021 UK Biobank study among 460,000 subjects discovered a linear increase in atherosclerotic cardiovascular disease risk after an Lp(a) concentration of 8 mg per deciliter. Basically, the higher the Lp(a) levels, the higher the risk of developing heart disease, and the lowest risk is below 8 mg per deciliter. At Lp(a) of 40 mg per deciliter, the risk increases by 20%, at 100 mg by 50%, and at 160 mg by up to 100%. I've measured my own Lp(a) levels, and they're fortunately 2.1 mg per deciliter. That's pretty much as low risk as you can have. I do have some heart disease in my family history, so I'm not going to take any chances, and I take preventive health quite seriously. But I've also seen dozens of people and their blood work, and they have Lp(a) levels in the 50s and even 150s. That's quite unfortunate because it's mostly genetically determined. But fortunately, there are some ways to lower Lp(a) levels slightly and reduce your total risk of heart disease, which I'm going to cover shortly. But the most important takeaway is that you should measure your Lp(a) levels at least once in your life to see where is your genetic set point. Lp(a) isn't part of the standard lipid panel, and most family doctors don't measure Lp(a) at all. That's because Lp(a) testing costs about $50, which is several times more expensive than regular cholesterol. However, you don't have to measure Lp(a) that often. But if you do measure Lp(a) and it's higher than what's optimal, then at least you know where is your genetic risk. And based on that information, you can focus a lot on the other biomarkers and be more aggressive in reducing your total risk of heart disease. Because if you have high Lp(a), you're at baseline at a higher risk. So it's more important to reduce the other risk factors. Having high Lp(a) doesn't mean you're going to get a heart attack. You might never even get heart disease, but it does mean that your baseline risk is higher compared to someone who has a lower Lp(a) with everything else being equal. Alright, now that we've established that the optimal Lp(a) levels are below 8 mg per deciliter, how do you go about lowering your levels? It's been seen that food doesn't affect Lp(a) levels that much, but higher levels of CRP that reflects inflammation does. This means that if you have high CRP levels, your Lp(a) levels are also going to be slightly higher. So lowering your CRP and inflammation can also lower your Lp(a) levels. So how do you do that? Losing weight and achieving a lower body fat percentage will lower CRP, because extra body fat promotes inflammation. For women, the optimal range is 18 to 35%, and for men, less than 15%. Having less visceral fat is more important for inflammation than subcutaneous fat. Visceral fat is around the organs, and it secretes pro-inflammatory cytokines. If you have a high waist circumference, then you have more visceral fat. For men, the optimal waist circumference is less than 90 centimeters, and for women, less than 70 centimeters. For the optimal ways to lower visceral fat, check out my recent video. Improving overall metabolic health will lower your CRP levels and also lower your visceral fat levels. This means having lower blood sugar, better insulin sensitivity, and also lower triglycerides. I have perfect blood sugar while eating 300 grams of carbs a day, so you don't have to be on a low-carb diet to achieve this. Just exercise, sleep enough, and lose the visceral fat. There are some supplements that have also been shown to lower CRP, such as glycine and NAC, melatonin, astaxanthin, curcumin, magnesium, taurine, and ginger. They've also been seen to improve metabolic health. When it comes to actual diet patterns, then it's been seen that a plant-based diet can lower Lp(a) levels and other atherogenic lipoproteins like ApoB within 4 weeks. Lp(a) levels can decrease by up to 32 nanomoles per liter, which is the equivalent to 13.4 mg per deciliter. That's quite a large reduction. The effects of different types of fats on Lp(a) levels are somewhat mixed. Some studies find that saturated fat reduces Lp(a) levels, whereas others that it increases it. So it appears that genetics is a big component to how your body responds to different type of fat intake, especially when it comes to Lp(a) levels. So in my opinion, the most important thing is to just measure your Lp(a) and see how your body responds. This 2024 review of 33 clinical trials on the topic concluded that a generally healthy diet, rich in unsaturated fats, regular exercise and weight management is recommended to reduce the risk of cardiovascular diseases. So you should just try to be as healthy of a person as you can, and try to optimize all the other biomarkers as well, such as your blood pressure, your body weight, waist circumference, VO2 max, blood sugar, inflammation, and all the other lipids. What about pharmaceuticals? There are some pharmaceuticals that can lower Lp(a) levels. The most potent drugs for that are PCSK9 inhibitors that can do so by 25%. PCSK9 inhibitors are a subcutaneous injection that you inject every 2 weeks. In patients with established heart disease, PCSK9 inhibitors were able to reduce the risk of cardiovascular disease outcomes by 23% in people with an Lp(a) level over 15 milligrams per deciliter, and by 7% in those with less than 15 milligrams per deciliter. So PCSK9 inhibitors are more effective in people who have high Lp(a) levels, over 15 milligrams per deciliter. The challenge with PCSK9 inhibitors is their cost. The annual cost of PCSK9 inhibitors is up to $5,000, which is quite a lot. That's up to 10 times higher than other lipid-lowering drugs. There's also something called lipoprotein apheresis that's been seen to lower Lp(a) by up to 86%. It involves taking out your blood and removing the lipoproteins from the blood physically. However, it costs around $2,500 per session, and you would need to do it regularly to see a long-term effect. Overall, the most important takeaway is to measure your Lp(a) levels at least once to see where your genetic baseline is at. With that information, you can make educated decisions about managing the other risk factors for heart disease. If you want to know about the lifestyle, diet, exercise, and supplement choices that can help you live longer, then check out this video next. Other than that, thanks for watching this video. Make sure to click the like and subscribe for future videos about living longer and staying healthier. My name is Siim. Stay optimized, stay empowered.